Hi everybody, thank you so much for joining so punctually to this afternoon's webinar with the University of Southampton that's going to have a healthcare focused, looking at everything to prepare you for your career in the future and applications, and considering all of the different options and possibilities you have within the field of health. We're joined by the fantastic Sarah from the University of Southampton, who will be leading on today's session. If you do have any questions during the session, you have access to the Q&A feature at the bottom of your screen. Please do pop any questions that you have in there. I'll keep an eye on them during the session, but we'll also leave a nice 10 to 15 minutes at the end to work through as many of your questions as we can. I can see the numbers of people making their way from the waiting room into the session are starting to settle now. So without any further ado, I'll hand over to Sarah from the University of Southampton. Over to you.
Thanks so much, Lydia. Good afternoon, everyone. It's a pleasure to be here today. My name is Sarah McGinley, and I'm going to talk to you today about preparing for your career in healthcare. And as Lydia says, I am from the University of Southampton, so I will talk a little bit about what we offer here at Southampton as well. So just to introduce myself, like I say, my name's Sarah McGinley. I am a principal teaching fellow here at the university. I am also an occupational therapist by background, have been for 25 years, I'm proud to say, and I absolutely love my career as a clinical occupational therapist, and I now teach into the occupational therapy programme here at Southampton. I'm also the lead admissions tutor across the school, across our suite of health science programmes, which I'm going to talk to you about a little bit during this presentation. So welcome, it's lovely to be here. So just going to give you an overview of what you can expect to hear from me today. So I am going to talk about our suite of professional health sciences programmes that we offer here at Southampton. So that includes nursing, midwifery, occupational therapy, physiotherapy, cardiac physiology, and audiology. I'm going to talk to you about our academic entry criteria, and that does vary across each programme, so I'm not going to go into detail across every specific programme, but I'll give you a ballpark and then guide you to where you can find more information if you need it. But please, as Lydia said, please do use the Q&A function if you've got any specific questions, and I'll try to answer those as many as I can at the end. Now, because our programmes are professional programmes, they don't just rely on academic qualifications. We need to look at your professional entry criteria as well. So all of our programmes are regulated. So that will be through a professional body who have expectations and standards. So I'll talk to you a little bit about what that professional entry criteria looks like and what you can do to meet the entry criteria when you're starting to think about your own career as a healthcare professional. I'm going to spend some time talking about personal statements, what they look like, what we're looking for, what all universities are looking for. So the information I share with you today will help you apply to any programme that is a professional programme, and it will really help you start to think, what do I need to evidence? What do I need to pop in that personal statement to get me the best chance of going through screening, through to an interview, and then through to getting an offer onto a programme? And my apologies, there is a typo there about biological sciences. I'm not going to talk to you about biological sciences today, and I forgot to whip that bit out of the slide, so apologies. And then at the end, there'll be time for your questions. Okay, so who is healthcare for? And I guess when we think about that, the best question to ask yourself is, what interests or motivates you? So if you can answer yes to these questions on the screen, then healthcare is definitely something that you should be considering. So if you can say yes, you're resilient, so you can cope with change, with things moving quite fast paced, and you can manage that without feeling nervous or anxious, and you're able to respond in the moment to those changes. You've got resilience, and that's something that we really need as healthcare professionals. If you're motivated and enthusiastic, so if you can work with people and motivate somebody to work on their goals, to really get the best out of their own healthcare journey, then that's also another key skill that we would look for. Are you trustworthy and supportive? So would your friends say that you are trustworthy and supportive? If so, then absolutely that's a key skill, a key value for a healthcare professional. You want your service user or your patient to really trust in you, to feel supported and to feel like actually this person is here to help me, to work alongside me in my journey. And then are you reflective and inclusive? So when I talk about reflection, I'm talking about, can you think about the things that you've done, maybe things that have gone well and not so well? Have you learned from them? How do you use that to change, to move forward? In healthcare, we're constantly asking ourselves, is this the best approach? Is it based on evidence? What is the gold standard? So if we can reflect on our practice and change our practice, then that's going to be better for our service users. And of course, we need to be inclusive. So we need to be non-judgmental. We need to accept people as we find them. And we need to understand that our own values might be different to the values of the person that's in front of us. So absolutely reflection, being able to be reflective and inclusive is really important. And then can you demonstrate these skills? So do you have initiative? Are you reliable? So you might be volunteering, you might be working outside of college, and I'm sure you're having to use those skills. So those sorts of things you really need in the healthcare environment. Do you have insight? Do you have self-awareness? So again, that's really linked to that reflective practice. So do you understand yourself? Do you understand how you respond in the moment to maybe stressful situations or trauma? How has your journey been as a healthcare service user? So often we use our own experiences to reflect on, okay, that was a good experience. That was a good example of a healthcare professional. That was not a good example. So I know where my barometer is and how I want to be when I'm working with patients and service users. Obviously, being able to communicate is really key. So being able to communicate at all levels, verbally, non-verbally, in writing, and being able to change your communication style depending on who you're talking to. So you might be 1 minute talking to a young person, and then within 5 minutes talking to a consultant that is managing the care of that young person. And being able to change your communication style is really important. And then, of course, be able to problem solve. So in the moment when things are changing, when things are maybe a little bit tricky, can you be creative? Can you think outside the box? Can you solve those problems in the moment? That's another key skill. And then do you have that ability and confidence to work with others and independently? So of course, as a healthcare professional, you need to be able to work in a team. You need to be able to work alongside other people, alongside other professionals, alongside families, alongside your patients and other key stakeholders. But then you also need to be able to be autonomous. You need to make your own decisions and you need to be confident working on your own. So if you can answer yes to those questions, then absolutely healthcare is something you should be considering. So I'm going to talk to you now about the suite of programs that we offer here at Southampton. Now, what you will notice is all of these professions cover the lifespan. So you can work in a really broad and diverse area from birth, sometimes pre-birth, sometimes in perinatal care, and then all the way through to elderly frail care, end of life, and then anywhere in between that. So all of our professions prepare you to work across the lifespan, which I think is really important to be aware of. So with nursing, you know, we're talking about a unique profession that uses a wide range of knowledge and skills. And really here, this is about providing person-centered and relationship-based care for your service user. You absolutely are at the forefront of changing people's lives. You make a difference as a nurse. You absolutely make a difference. And I'm sure you can remember times yourself when you've been treated by a nurse, be that in the community or in a hospital setting. Now, in the UK, there are 4 fields of practice. There's adult, child and family, mental health, and learning disability. And at Southampton, we offer programs in adult, child and family, and mental health. And we also offer combined programs. So you can do a program in adult and child, as an example, or child and mental health. We don't offer learning disability here at the University of Southampton. Midwifery, again, another very diverse career. The word midwife means with woman. Okay, so again, it's a profession that's dedicated to pregnancy, childbirth, and that postpartum period. So once the woman has given birth, you are still involved with that care thereafter. And it really is about being with the woman, being with the family, being with the baby that is born. So to be an advocate and gain that rewarding career, the pathways are really extensive. Okay, there's speciality roles. And if you come to one of our open days, we can talk to you about those various career routes. But again, it's a very diverse career. So often I think when we think about midwifery, we think in a hospital, working with the woman to give birth. But there's a whole raft of other opportunities available out there. Okay, and again, there's that communication. You need to have knowledge, be compassionate, be non-judgmental, really be there for the woman, which sometimes can be a really, as you can imagine, quite a challenging, quite stressful, sometimes traumatic time. But not only to be there for the woman who's going through that, but also their families and the newborn. And then we come on to occupational therapy. So this is my background. And really the key to occupational therapy is that we help people live their best life wherever they are living. So that could be in their own home, that could be at work, that could be at school or college, it could be out in the community, it could be accessing green space. So we work wherever people are. And we really, what our aim is that we want to help people do the things they want or need to do. So if you were to think about yourself, think about an occupation or an activity that's really meaningful to you. And think about if one day you couldn't do that because you had an illness or an injury. An occupational therapist would help you get back to doing those meaningful activities that you enjoyed doing. And that can range from something as simple or as something that we take for granted, like brushing your teeth, all the way through to working as a chief executive in a high functioning business. So we work with everybody across all ages and stages of life, and that's across learning disability, physical and mental health. So we're dual trained as occupational therapists. And the diversity of places where you can work is pretty much never ending. So traditionally, we are in the NHS, but we work with charities, we work with the third sector, we can work in secure units, in prisons, in neuro units, in hand therapy, you name it. Wherever there's people, you will find an occupational therapist. And then, of course, we have physiotherapy. And so occupational therapy and physiotherapy work very closely together. Often you will see an OT and a physio working together in unison, looking at different areas of function for that person. Of course, physiotherapy focus very much on restoring movement and function and that physical function for that person. Again, you can treat people across a range of conditions and across the lifespan. So from very small babies all the way through to end of life and then anywhere in between. And your focus as a physio really is around thinking about musculoskeletal issues, so around the bones, joints and soft tissue. You might work in neurology, so thinking about the brain, the nervous system, the spinal cord, around cardiovascular issues, so the heart and circulation. Thinking about the lungs and breathing, so people with long-term conditions that might include chronic obstructive pulmonary disease, asthma, those sorts of things, so anything that involves difficulty with breathing. And again, like I say, across the lifespan. And again, like occupational therapy, you can work pretty much anywhere. And it's all of our careers are very rewarding and improve people's quality of life. Then we move on to cardiac physiology. So this is a profession where you work really mainly in hospitals. You are working again on the front line and you are working to perform diagnostic tests to look at, detect, understand heart disease. So again, you're really at the front line. You've got an opportunity here to save lives and to make a real difference. So anybody that's living with a cardiac pathology, cardiac physiologists will be involved. They work as I said before, autonomously, so work on their own, but also as part of a multidisciplinary team. So they'll work with surgeons, they'll work with nurses, they'll work with radiologists, so a whole raft of people. And like it says there, cardiac physiologists save lives. And then we move on to our final profession, which is audiology. So this is all about the ears. So we're thinking about focusing on hearing and balance. So anybody that's had an ear infection before will know that that can really put your balance off. It can make you feel very unwell and unsteady on your feet. So an audiologist is looking to diagnose and assess what is going on in somebody's inner ear. They will look at assessment, but also at rehabilitation. And again, as we've seen with all of these professions, you can work across the lifespan. So from babies all the way through to older people. Audiology is moving really quickly, so that the tech involved in audiology is really quite fascinating. Whenever I see our audiologists do a talk and they bring their kit, it's absolutely fascinating, and it's moving all the time. And here at Southampton, there's a lot of research going on within this field, so it's a really exciting time to become an audiologist. And again, there's that word, transforming people's quality of life, and all of these professions are really at the heart of improving somebody's quality of life. So I'm going to talk a little bit about what our entry requirements here are at Southampton. And like I say, they vary across the professions, and you can find more information on our website. There is a link there to our website, and I hope that we'll put that in the chat for you as well. But our entry equivalents are if you're doing A-levels, from AAB through to BBC. So it's quite a range. And obviously we accept alternative qualifications to A-levels, so please have a look on the website. Generally, most of our professions will be asking for a science or a social science. So if it says a science, we're looking at physics, chemistry, biology. Not all three, one will be sufficient. Social science, we're thinking about psychology and sociology. We do make contextual offers, so it's really worthwhile looking at our website and seeing where that comes in, and checking with your college to see if you meet the requirements of a contextual offer, because that means our standard offer is lowered by up to 2 grades when you make your application. And if any of you out there are doing an EPQ with your A-levels, so your extended project qualification, and that is centering around something to do with healthcare, that's a really, really good thing to add to your personal statement. That really helps in terms of demonstrating where you're looking to go with your next move. So I talked about earlier that it's not just about qualifications. So really all of our programs are looking for professional skills as well. And that's because they are registered qualifications. So once you graduate, once you finish your 3-year program, you are then eligible to apply to a registering body. So all of those registering bodies ask us to make sure that you are coming with the skills and the values that you need to become a healthcare professional. So there are ways that you can evidence this, and a really great way to do this is through shadowing. So if it's possible, get some profession-specific shadowing if you can. We know that that can be challenging. We know that that can be difficult. So don't worry if you can't get healthcare-specific shadowing, but if it's with people, that's the most important thing. So something that is people-facing, that involves you working with the public and communicating. Volunteering, that's a really great way to evidence that you are doing people-facing work. That might be through your college, it might be through a hobby that you have, it might be just through an interest that you have. Any community activities that you're involved with. So again, if you run any societies at college or you're involved with anything extracurricular, that can be really good evidence as well. And then anything that your school or college provides. So if part of your program includes going out into placement, make sure that you're trying to align that placement experience with something that you're interested in. And ultimately, it's essential, and the more the better. So like I say, we understand that it's not always possible to get work experience, but there are lots of different opportunities now So virtual work experience is an option. So have a look around and see if anybody's offering virtual work experience days. I know at University of Southampton, we do run this, and there'll be some dates coming up soon. So please watch out for those. So I'm going to move on now to talk about the personal statement. And from this year, you may or may not know that UCAS have changed the personal statement a little bit. They've made it more structured and easier for you as an applicant. So if you scan the QR code on the side of the page there, it will take you to the information about personal statements. But I'm going to talk you through that now. So there's 3 main questions now. So question 1 is, why do you want to study this course or subject? So really thinking about, what is it about the program that you are applying for that has appealed to you? What is it that interests you about being a nurse or a cardiac physiologist or a physiotherapist? And then how have your qualifications and studies helped you to prepare for this course or subject? So here you don't need to tell us or tell the institution about the qualifications that you're studying, because they'll be able to see that on your application. But what is really interesting is, how is biology shaping your thoughts, your thinking? Maybe you're studying history, and part of studying history or English is being able to develop an argument and present that. And that's really important as a healthcare professional. So if you can align these things in your application, that will really help. And then question 3, what else have you done to prepare outside of education, and why are these experiences useful? So that's where your shadowing opportunities come in. That's where your work experience, your volunteering experience comes in. But also really valuable there is your lived experience. So if you have experience of being cared for or caring for someone else, then that is really valuable experience, and sometimes is very, very powerful to include in your personal statement if you feel happy to do that. So we would only encourage you to do that if that is something you feel comfortable in doing. So when you're thinking about pulling your personal statement together, think about these questions. You might want to take a screenshot of this or take some notes. But why do you want to be insert your profession there? So why do you want to be a midwife? Why do you want to be an occupational therapist? What is it about that profession that's really piqued your interest? And then what do you think that profession is about? What do you understand about it? What have you found out so far? And then what skills, qualities, values have you developed that will align with that profession? So if you think back to that one of those first slides I talked to you about resilience, about motivation, about being person-centered, all of those things are what is needed to be a healthcare professional. So if you can evidence those, you're on your way to getting through the screening process. And then think about the relevant work experience visits that you've done. Again, think about your lived experiences if that is appropriate. And here, be reflective. So don't just tell us what you've done. Don't just be descriptive. Tell us what you learned. How did it change you? What will you take forward into your journey to becoming a healthcare professional? Because that's really powerful. And then what community activities or extracurricular activities are you involved in? And importantly, what have you gained from those activities? So how have they shaped you? How have they shaped your understanding of the profession that you're looking to go into? Okay, so this really brings me back round to that first slide. So what to include in your personal statement. And this really is your chance to shine, to bring in the evidence about yourself. So basically, if you can evidence any of these things here, I'm not going to go through each one because we've already talked about some of them in great length. That is going to be good evidence in your personal statement. So just telling us that you're resilient, okay, that's great, but tell us how you're resilient. Can you give us an example of why you feel you're resilient? What's happened along the way to build that resilience, and how will you use that going forward as a healthcare professional? So if you can give, you're not going to be able to give examples of all of those, of course, but if you can pick some of those out and give us some evidence, again, that's going to put you in a really good position to come through screening and into an interview. So thinking about, where can a career in health sciences take you? I mean, where can't it take you is the question, really. I've worked all over the UK. I've worked in America. I have colleagues in Canada, in New Zealand, in Australia. So if traveling is something that really interests you, this is a great passport to the world. Of course, there are lots of opportunities in the UK as well, and now is a great time to train. So you'll see there on the right-hand side of the screen some bandings. So if you work in the NHS, and often if you work in the private sector or the charitable sector, they will mirror what goes on in the NHS. So you'll often hear these bandings. So when you first graduate, you'll be a band 5. So you'll go in at that what is known as a basic grade level, band 5, and that would be your starting salary of £29,970. Now, if you're in London, there'll be a London waiting on top of that. And obviously, as time goes on, that will incrementally increase. So in 3 years' time, that will be higher than it is now. And then you progress through the bands. So you can stay as a band 5. Often people stay around 18 months, 2 years, and then they start to progress through the bands. Band 6 is obviously more experience. When you get to band 7, you're starting to manage people. Band 8A through to 8D, really you're looking at sort of managing whole services. You can remain clinical and you can be a clinical band 7, absolutely. So you don't have to climb the ranks, but if you want to, the opportunity is there. Of course, it doesn't just involve clinical work. You can work in education. So I worked for, 18 years in clinical practice and then moved into education, which is where I now am working. Research is another area where people combine their skill. So some people might carry on working clinically, but combine that with a research role as well. Obviously, there's leadership roles, consultancy roles, and you can go out and work in private and independent and charitable practice as well. Literally, the opportunities are endless. So why come to Southampton? What is it about Southampton that is unique? So what we're told time and time again by local, national, international employers is that we are respected. So our students, our graduates are desired out there in the clinical world. All of the programs lead to professional registration, so that eligibility to be registered with a governing body. There's excellent graduate and career opportunities, both in practice, education and research. It's here at Southampton, it's really, I know it sounds cliche, but it really is a community. It's inclusive. We have a diverse range of students coming in and everyone really does belong. And you can see here some statistics in terms of employment. So for our allied health professions, so that will be occupational therapy, physiotherapy, cardiac physiology, and audiology, 98% of graduates were in employment or further study 15 months after they graduated. And the same for nursing and midwifery. And often, anecdotally, when I talk to our graduates in occupational therapy, those who don't go straight into a job, it's because they want to take some time out, they want to take a gap year, they want to go traveling. So really the choice is theirs in terms of, do I want to get a job straight away or do I want to delay it and go and do something else before I enter the world of work? So I've talked for a long time, but thank you very much for listening. Please do pop your questions in the chat. There are some email addresses there, including my own. So my name is Sarah McGinley, as I said. There's the admissions general email, and there is our website. And I'd also really like to guide you to a short video, which is a summary really of what I've talked about here on how to make an application. So please do take some time to go and read that. But thank you very much for listening. And I will stop sharing.
Sarah, thank you so much. That was really insightful, not only to how students can identify the best healthcare career for them. I think quite a lot of people that have joined today might know that they're interested in a career in health, but just aren't sure how to pick that right pathway for them. And then particularly focusing on applications, which we've had quite a few questions come through. And Leon asked a question almost near the start of today's session, which I thought was a fantastic question, around what mistakes do people tend to make when they're applying for healthcare courses, either in personal statements or interviews, perhaps? What kind of things can students avoid doing?
Oh, Leon, that is a really, really good question. We're not here to trip you up at all. Okay, so I think what I would say, Leon, is having a clear direction of what profession it is you're interested in. Now, some students are interested in medicine, and if you are interested in medicine, you know that you have five choices, so you can make your choice and then add another option. So often health sciences programs are the additional option to medicine. So it can be tricky tailoring your personal statement when you're making an application for medicine. But as long as you make sure you are being really clear about what program it is you're interested in. So my biggest piece of advice would be to not make your personal statement generic, make it really targeted. Tell us why you're interested in a career in XYZ, and make it very obvious. If it's physiotherapy that you're interested in, that's what I'm interested in, and that's the program for me. Because sometimes we can read a personal statement and it's quite obvious that someone hasn't made their mind up, and that's okay, of course. But chances are you might come unstuck a little bit, or an admissions tutor might want to ask you further questions about, are you sure you want to be a physio, or actually are you leaning more to being a cardiac physiologist? So be really clear, be really explicit would be my big piece of advice.
Fantastic. And I know we've touched on it a little bit today, but if students are still potentially torn between a couple of different options and want to make sure that in their personal statement, they can say, this is definitely out of all of them, they all sound fantastic, but this is the career I really want, or the pathway I want to explore. What can they do to help make that decision, and know which is the right one?
Yeah. So I think shadowing is really important, and I honestly I understand how difficult that can be. So look for opportunities that are virtual work experience. Go and speak to people. Do you know people in your family who are healthcare workers or that work with other healthcare workers? So as soon as you get your foot in the door with somebody, chances are they will know someone who is an OT or a physio or a social worker or whatever it is, and then they will introduce you. So sometimes just making that step and networking. So even if, I don't know, so you don't want to be a nurse, but you want to be a midwife, going to shadow a nurse and having a discussion with that nurse and saying, I'm really interested in midwifery. Do you know of anyone? And then generally, healthcare workers are very, very inclusive. They want people to come into the profession. They love shadow it, people come into shadow, they want to share their expertise. So, I mean, that's how I found out about OT. Was I had a coffee with an OT, literally really informal, and then she put me in touch with a whole wealth of other OTs that I was then able to go and shadow. So don't get, refuse an opportunity is what I would say, thinking that, oh, that's not going to lead to anything, because you just don't know where it's going to lead.
Fantastic. Yeah, I think that's really great advice, and not always looking for work experience that's listed elsewhere, but perhaps picking the phone up and speaking to somebody, and seeing what you can get
Definitely.
that way.
Yeah.
A final question perhaps on applications, for now at least. Max, I suppose we've spoken about it a little already, but Max would like to know what's one thing that can make an application really memorable? So what are those applications that stick with you, and why did they?
Absolutely. Thank you, Max. That's a really good question. Now, I can tell you as an admissions tutor, I love to read a narrative, your story. I want you to come out of the page at me. So I want to see that individuality. There's nothing worse than reading personal statements that are cloned, that are generic. I want to understand your story. So if you can include your own lived experience, if you can include some anecdotal evidence, some things that have shaped your journey, that makes it all the more enjoyable for your admissions tutor to be reading it, and makes you want to know more. And makes, I want to invite this person to interview because I want to understand and unpick this story a bit more. So I would really encourage you to share of yourself, again, whatever you feel comfortable to do. So never obviously disclose something that you don't feel comfortable with. However, your own experiences are really very powerful.
Great. That's really good advice for students to take away and reflect on. I know there'll be lots that are in the 2026 cohort that will be in the process of writing personal statements, or perhaps luckily those that are still in year 12 and have got an extra year to go and gather lots of that experience too. Some students are very rightly thinking about the career pathway and once they finish their university studies or even on placements during studies. And there's a student in the chat that's a bit unsure. They feel like they like high pressure situations and they know that careers in healthcare are often high pressure situations, but sometimes feel that they can crack under pressure or perhaps become a bit too stressed.
Yeah.
How can they handle a career in healthcare if there's someone that, is unsure how or whether they'll be able to handle the pressure?
That is such a good question, and that in itself shows insight and reflection. So that, if you think back to that slide where I was talking about being insightful and reflective, that is excellent, because learning and knowing how to look after yourself in those situations is really key. So knowing who your support network is, and that's in work and outside of work as well. So what are the things that fill your cup? What are the things that bring your levels down when you've had a stressful day? So is that being out in green space? Is that going to the gym? Is that reading a book? Is it picking the phone up to a friend? But also within your workspace, who is your support network? Now, I speak from experience in terms of working in the NHS, it's hugely supportive. So peer support is a very big thing. So when you come in as a band 5, you are automatically connected with other band 5s within that service. You have regular check-ins with those buddies, but you have formal supervision as well. So you have supervision with somebody who's been qualified for a period of time, who can guide you through maybe some challenging, tricky times. And also, yes, it can be pressured, but it brings so much joy and happiness as well. So I wouldn't want you to think, oh my gosh, it's just too stressful. Every job has its stressors, and it's just about knowing where to seek help and how to manage that. And I think knowing how much to give of yourself and when to have boundaries. And that's something that you would learn on the program. So we'd never expect you to come to university knowing all these things. That's why you're coming for 3 years, to practice and to be in a safe space and to understand what that looks like and how we can help and support you. Yeah, but really good question.
Yeah, I think that's really reassuring for students to know as well that, as you say, during the degree itself, there's all of that support in place. But even once you're
Absolutely.
into the workplace, you're not just then left on your own to do that job.
Never.
There's lots of
No.
support structures in place to help people make that transition from university into the
Absolutely.
career pathway.
Definitely.
I know for a lot of, well, pretty much all of healthcare courses, there's placement opportunities. They're quite hands-on learning roles, but Favour is curious as to whether courses in healthcare are still academically stimulating. So with all the practical elements put to one side, what's the academic side of these courses like?
Absolutely. Again, really, really good question. So, it's a combination. It's a combination of experiential learning, but also having that academic knowledge. So it's really important that as healthcare professionals, we know how to critically appraise. We know how to look at the latest evidence and say, is this good, or actually is this not going to work, and why is it not going to work, or why is it going to work? So absolutely, on an academic level, we need to be critical. We need to be able to synthesize information. We need to be able to be involved in research. So all of our students will be involved in a research project, which will directly impact healthcare. So that's really exciting. I've got some students next month going to Portugal to present their research that they've been doing in year 2. So there's always opportunities to share, disseminate your work. We've had students that have contributed to chapters in books. We've had students that have published their work in peer-reviewed journals, and we really encourage that here at Southampton. But there's a balance. So we appreciate that not everybody will want to be heavily involved in research, and not everybody will want to be heavily involved in the clinical practice, but there's a balance between those two things, and there are opportunities that you can pick and choose while you're here.
Fantastic. And I suppose, yeah, we'll group together some of the course related questions. So we've
Mm.
looked just now at sort of the academic elements of the course, but one student is asking, how are students assessed on a healthcare course? Is it exam based? Is it practicals?
Really,
And
really
what do that there, I think at the moment, especially, we all want to succeed, but more so
important.
than ever with university courses, perhaps they're curious as to how many people fail. What are the success rates like if they were to pursue a
Absolutely.
course in healthcare?
That is a really, really good question, and we get asked that question a lot in terms of assessments. Now, we are all individuals and we all learn differently and we all flourish in different environments. And some of us will flourish in a pen and paper exam, others will flourish in a presentation. So all of our programs use a multitude of assessments. So there's never just one assessment. So I can give you an example that across our programs, there is anatomy and physiology taught across all of the programs at the same level. And that includes a pen and paper exam. But that is the only set of exams that you do. You then have different platforms or media to present. So you might do a group presentation, you might design a poster, you might record a podcast, you might do a video, or you might have what's called an OSCE, which is a practical exam where you are doing hands-on something with somebody that is an actor. So they're pretending to be a service user, and you are the nurse or the OT or the cardiac physiologist in that scenario. There will, of course, be essays. There will be reflective writing. So to be a healthcare professional, we need to be able to write in the first person. We need to be able to understand ourselves, to then be able to understand other people. So I think one of the strengths of our program or our programs is that it's not one size fits all, and there are a multitude of assessments, and some of them will be suited to some of us and others will be suited to others. But I guess my point is they're not all the same. So there's variety in there.
Yeah, and as we've said, even when it comes to the careers, but also at university, there are huge support networks there in place to make sure that students are
Yeah.
succeeding in all of those different types
Absolutely.
of
Yeah.
exams
So
too.
so we would absolutely consider reasonable adjustments. So anybody that's coming in with an additional learning need, we make sure they're supported through that admissions process and then all the way through into transitioning into university on your journey, and then out the other side. So we have a really supportive student disability and inclusion team that will look at students' individual needs, make recommendations for reasonable adjustments, and then we as lecturers incorporate those reasonable adjustments into our teaching. And that could include things like additional time or sitting in a room away from others where there's no distractions, regular breaks during the day, those sorts of things. So, and again, it's not one size fits all. It will be based on individual need. We also have a 24/7 support student hub here. So, if you're on program and something happens outside of office hours, there's always someone to talk to and there's always someone to pick the phone up to.
Fantastic. Yeah, great that support is there for students as well when it's a big transition, isn't it, from A levels, BTECs or IBs or students are
Absolutely,
studying at the moment through to university. So to know that
definitely.
support network is there throughout is fantastic too.
Yeah,
Quite a few of the questions in the Q&A are related to bits we've already chatted through. So if you have got a question that you feel is unanswered around entry requirements, we will be sending out in the email tomorrow the links to the University of Southampton's website. As Sarah mentioned at the start, all of the different course areas will have different entry requirements, and those might look different dependent on whether you're a UK student or an international student. So we won't go into all of those today because I think there will be tons of questions, but we'll send that information around afterwards. And we've also covered lots of top tips when it comes to choosing between different course areas. I can see some people are still stuck when they're choosing or are thinking about the differences between nursing and midwifery and what might be the best fit. I don't know whether you agree, Sarah, but I also think that open days can be a fantastic opportunity if you are a little bit unsure to go and sit in a session
absolutely.
dedicated to each of
Yeah.
those individual programs.
Yeah, definitely. We've got a couple of open days coming up, so I'm sure we'll put those out in the email. But the 5th of October and the 19th of October, you can sign up to come to one of those. And our open days are very practical, they're very hands-on. So we will have subject talks for every profession that I've talked about today. So much more involved than what I've talked about, but also practical skills labs where you can come and you can experience what it's like to be a midwife, to be a nurse. You can come and see all of our facilities. You come see our sensory room, our activities of daily living suite, where we do a lot of simulated practice. So yeah, come and see us at an open day, and you'll get to meet our brilliant student ambassadors as well, who are all on programme and will be able to tell you about their own experiences of being on programme. I also run a personal statement workshop, which is much more involved than what I've talked about today as well. So yeah, absolutely come and see us at an open day. It'd be lovely to see you.
That's it. And so these webinars are a wonderful opportunity to have a snapshot of everything that the University of Southampton's got to offer. But yeah, definitely encourage students after today to explore those open days. They're great, especially one, you're going to be spending a lot of time studying at that university, so it really helps to see the campus. It brings the course to life for you. You'll learn tons more, being able to get really hands-on, but also for those students that are stuck between courses as well. It
Absolutely.
does bring us to 5:15. So it's a nice end point to think about where students can take their interests after today's call. As we've mentioned a couple of times, we will reach out tomorrow by email with a recording of today's session, as well as helpful links to the University of Southampton's website. But it just leaves me with the opportunity to say thank you to all of the students that joined us, and also a huge thank you to yourself, Sarah, for what's been an incredibly informative session for the students this
Thank you, Lydia. It's a
afternoon.
pleasure. And thank you everyone for listening. Thank you.
Great. Hopefully see you all on another event soon. Bye,
Thank you.
everyone.
Bye-bye.